The last few weeks of pregnancy can be challenging for many women. They often feel physically uncomfortable, and they may be anxious, but excited about meeting their baby for the first time. Sometimes minor problems or worries arise that can add to their anxiety, and women may feel pressured to induce labor, even when it would be safe for labor to begin on its own. It's important to remember that induction actually means forcing your labor to begin before your body and your baby are ready for birth. Induction can be a difficult and lengthy process, and in some cases it may not work at all. Research has shown that induction significantly increases your risk of having an unplanned cesarean surgery. It also increases your risk of needing epidural anesthesia or other drugs for pain relief, having a vacuum or forceps-assisted birth, or having a low birth weight baby. Letting labor begin on its own is usually the easiest and safest option for several reasons. Medications that are used for induction can make contractions stronger, longer, and more frequent than naturally occurring contractions. This can make labor more painful and tiring, and in some cases may cause distress to the baby. In addition, an induced labor usually requires having an IV and continual electronic fetal monitoring, which makes it more difficult for you to change into positions that can make you more comfortable and help your labor progress. Finally, when your labor begins on its own, you will feel confident knowing that both your body and your baby are ready for childbirth. Sometimes a medical condition or complication makes labor induction necessary for the safety of you or your baby. However, induction may also be recommended when waiting for labor to begin on its own would be a better option. It's never a good idea to induce labor for convenience, such as wanting your baby born on a certain day. Research also shows that in healthy pregnancies, labor should not be induced because a baby is thought to be too big. Care providers often overestimate the size of the baby, even when an ultrasound is used. Inducing for this reason increases the risk of cesarean surgery. To help you decide if induced labor is the best and safest choice for you and your baby, ask your healthcare provider, why are you recommending an induction? What are the risks of waiting until my labor begins naturally? What are the benefits of waiting? Can we try natural alternatives first? Another reason why labor should begin on its own is that it helps you gradually ease into the physical and emotional aspects of childbirth. Many women consider the earliest part of labor to be an exciting and enjoyable part of their birth experience.
We had a chance to, I think, connect with one another before the birth actually took place. I think that was all very helpful in progressing the labor and just mentally preparing me for what was about to come.
For more information, visit our website at mothersadvocate.org.